Hey friends, Dave Closson here, and I'm glad you're tuning into this very special episode of the Prevention Leaders Podcast. Today, I'm sharing something incredibly close to my heart, the official launch of the Tennessee Alliance for Drug Endangered Children and Handle with Care Guide. Now, this guide has been months in the making, and I had the honor of leading it through my company, DJC Solutions. From the very beginning, we knew this guide had to be more than just a document. It needed to be a true tool for change. So we rolled up our sleeves and dove deep. We conducted focus groups, ran surveys, held one-on-one interviews with stakeholders from across Tennessee. Then we took everything we heard, every insight, every challenge, every success story, and turned it into a practical, powerful guide designed to help communities take action. This guide was just officially announced at the RX Summit in April. And now we're excited to share it even more broadly with all of you. In this episode, you'll hear the full launch conversation featuring two incredible leaders, Tabatha, the Tennessee Statewide DEC Coordinator, and Evangeline, the Handle with Care Coordinator. They've been on the front lines of this work and bring invaluable wisdom and lived experience to the conversation. Whether you're in prevention, education, law enforcement, or another field working with children and families, this guide is for you. It's about collaboration, connection, and creating safe, healthy environments for every child, especially those impacted by substance use. So settle in and let this episode be both a celebration of what's possible and a call to action for what's next. So let's get into it. Hi, everybody. I'm Dave Closson, and I'm excited to be here to introduce the Tennessee Alliance for Drug Endangered Children and Handle with Care Guide. As someone who's dedicated to supporting coalitions and professionals working to protect and empower children impacted by substance use, I've been deeply involved in the development of this guide, and this project is truly about creating a lasting impact for drug endangered children. Now, today, we're here to give you an overview of this comprehensive resource designed to support and strengthen best practices for those individuals working in fields that intersect with drug endangered children across child welfare, law enforcement, education, social services, and beyond. Our hope is that this guide will be an invaluable tool for collaboration and for care, not just in Tennessee, but nationwide. The purpose of this video is to introduce the Tennessee Alliance for Drug Endangered Children and Handle with Care Guide, comprehensive resource created specifically for professionals working with drug endangered children. Through this video, we want to emphasize how this guide not only brings critical support to Tennessee, but also offers a model of best practices that can be used nationwide. It's designed to foster collaboration among all professionals who intersect with the lives of these children, creating a unified approach to their care and safety. So whether you're part of a coalition, an educator, a healthcare provider, or beyond, this guide is here to support your efforts to make a meaningful difference in the lives of drug endangered children and their families. So joining me today are two remarkable leaders who have been instrumental in this project. First, we have Tabatha, the Tennessee Statewide DEC Coordinator, and we've got Evangeline, the Handle with Care Coordinator. Tabatha and Evangeline bring years of expertise and dedication to serving drug endangered children and fostering community collaboration. Together, we'll share how this guide can support those working to address the challenges these children face and how it provides a framework for stronger, more unified community responses. So both the Tennessee Alliance for Drug Endangered Children and the Handle with Care initiative are crucial steps in addressing the unique and the serious challenges faced by children impacted by substance use. Now, this guide was created with the belief that all children are drug endangered children, and every child deserves a safe and supportive environment free from the risk associated with substance misuse around them. This guide is designed with a wide range of professionals in mind and really hopes to help folks that connect with children affected by substance use. We know that it takes the whole community working together to provide these children with the support and protection they need. So by bringing everyone to the table, this guide empowers professionals across sectors to collaborate more effectively and to create safer environments for these vulnerable children. So without further ado, welcome Tabatha and Evangeline.
Thank you.
Thank you, Dave.
All right. So I'd like to offer my first question to you, Tabatha. And I was wondering if you could kind of open or unpack why this guide was really created, the vision behind it, and what problem you saw it really addressing for folks.
Well, I'll have to tell you, Dave, over the past five and a half years, we have presented the work that we've been able to accomplish in Tennessee at multiple conferences across the United States and to other drug endangered children alliances across the United States. And we realized during that time that we had something really special in the state of Tennessee, but saying that we had nothing to share with them. I mean, we could go as, coordinators there and present on a panel for a conference. We could bring our DEC coordinators with us and have them present about how it's being, they're implementing the program there within their communities. But then at the end of our sessions that we were presenting at these conferences, they would ask us, do you have anything that you can share with us? Anything that you can give us, a guide? There was always that interest there, but we had nothing to give to them. So we realized that we did have something special and unique in the way that we were implementing this within the state of Tennessee. Evangeline can talk about the Handle with Care model, and I'll share about the National Alliance for Drug Endangered Children approach, or the model that they had. We did have two promising practices already, but what we did was we took those two promising practices and involved them into one promising practice for the state of Tennessee. Again, we wanted to be able to share our work and resources. And doing that, we had to be able to formulate it in a way that people could, either have a written, like a guide, a printed copy, or also streamline it so that we could have something where they could see our work and being implemented using an online version for our training.
Wonderful. And I know you've chatted for hours on the backstory and the need for this guide. And it's always so inspiring to hear sort of that story you shared behind it. And so I want to ask Evangeline, could you share with us, how you see Handle with Care fitting into this guide, and maybe why it's a critical component in supporting drug endangered children?
Well, I think for TADEC and for Handle with Care, we recognize that it's not enough to, respond eventually. We want to actually be able to prevent and intervene in the moment for a lot of these kids. And Handle with Care is a really interesting initiative because it really emphasizes first responders, law enforcement, school districts, and community partners, and figuring out how we can have children access the resources they need in the moment more quickly. And so I think overall, it aligns very directly with drug endangered children, because a lot of the kids that are experiencing really difficult situations in their home life, we don't always know that they're happening, but they're at school the next day. And so how can we ensure they're getting what they need the next day? And then over time, maybe that is getting resources through a local coalition or through their entire family. And so I think, we appreciate the way that Handle with Care can be an early alert system, but then coming alongside with the coalition that's already has those partnerships in play. They already have the cross-sector collaboration, and so they're able to bring the community together and then also sustain long-term resources and services.
Yes, indeed. Bringing everybody together, and really, I love how you said that resources right there in the moment. That is just ever so powerful. Tabatha, what are some of the key features of the guide that our readers should be excited about, look forward to seeing?
Well, because it's a multidiscipline model or approach that we're using, Dave, and Evangeline alluded to the coalitions, we embedded our programs within existing coalitions, prevention, anti-drug enhancement coalitions across the state of Tennessee. And so in doing that, the people that are, getting to have the use of this guide would not only be a coalition director or a coalition coordinator for their state or their community, but it would also be able to utilize for their sectors that are sitting at the table with them, how they can all comprehensively come together to implement a program like this. Our goal and intent is not to recreate work for people, but to streamline the work for them, to say, hey, you've already got these people at your table. Let's just connect those resources and those dots to make it, more useful. Again, by having it embedded within these coalitions and then being already familiar with the strategic prevention framework, again, those sectors, those disciplines are already at the table. One of the things that I think they'll be able to take away from this guide, again, is the case studies that you have been able to put together for us. I think that is imperative in seeing that, not only do we talk about this, but we have DEC coordinators, we have coalition directors who are sharing their work, whether it's through video or whether it's through their recordings or through, quotes that they've said about the work that they're doing. But it also has the tools and templates in there. Is our coalition ready to develop this program? Or do we have the people at the table? Do we have law enforcement? Do we have Department of Children's Services? So you have those checklists there within the guide and in the online training as well. You have those checklists there available for them, but you also have the evaluation of it as well, the checklist showing, okay, so this is where we are. Do we move forward? Do we have the capacity to make this happen in our community? Or do we need to back up and punt and say, hey, what else do we need? It's almost impossible to implement the Handle with Care program if you don't have law enforcement at the table. It's not going to work. It's not going to work if you don't have the education sector or discipline at the table. Those are two key components. So in having this guide, whether it's for the DEC program or for the Handle with Care, you don't have to have a coalition to have the Handle with Care program. In our belief, if we have a DEC program, we do need the Handle with Care program along with it to be most effective in our community. So again, having those pieces, having those templates there, and the step-by-step instructions. It's detailed guidance on how to integrate the DEC and the Handle with Care programs within their organizations and their communities.
Step-by-step instructions, actionable, tangible worksheets and guides to really be able to not just read and learn, but put that knowledge into action. Yes. See, it can be very effective. What a tool. What a tool. All right. Now, kind of continuing down that sort of resources specific and tools and guides. I'm curious, Evangeline, how does Handle with Care enhance the guide, and what are those specific resources that are available to folks?
Well, I think across the nation, there's a lot of people implementing Handle with Care, but everyone's doing it a different way, which I think in some cases is wonderful, but also for a lot of people when they don't know where to start. We have a really solid foundation in terms of our process. So there's training resources that highlight, what content we give. We have a video on there where they can access that in terms of being able to utilize that for their law enforcement or their school districts. We, talk and demonstrate our Handle with Care notification system, which is probably been the biggest tools that we've been able to utilize because it allows people to have a free resource that they don't have to reinvent the wheel and come up with a system. And so we have increased our notifications because we have a statewide system. And so it highlights that as well as trauma-informed practices. So, what resources we give directly out to the educators and also ways that we kind of embed those resources just in the process. And so there's some worksheets along that way. And then also just talking about collaborative planning, like how do we actually make this happen? Because I think sometimes there is still a national model that kind of broadly articulates how to get it started. But we talk about what specifically worked for us, what made it easiest to implement it. We have 95 counties in the state of Tennessee. And so it's no small feat to try to get it every place. And unfortunately, we don't have, drug endangered children coordinators in every community who are able to create and already have that existing cross-sector collaboration. So we really needed to make it simple and efficient for a lot of So it could be anyone in the community that could start it up. And so I think hopefully there's at least a taste of the resources that we have and support that we can offer.
Yes. And folks, there is a whole suite of resources, and also not just with the Handle with Care, but how Tabatha referenced the case studies. Like when you start using these tools, you're not just using tools, you have access to a statewide network of other individuals doing the same work that are there, eager, willing, and happy to help you succeed and share their lessons learned, their resources as well. Y'all have a community across the state, and that's powerful, because together is absolutely better. Kind of touched on a little bit earlier, Tabatha, but could you sort of paint the picture of how you envision coalitions and professionals really using this guide in their day-to-day work?
Well, I think about the work of a coalition, and I know that I was previously a coalition director in my county in the state of Tennessee. And then I assisted some other coalitions across the state of Tennessee in the development of their coalitions. I mentored them. So I had a connection as we were building the Tennessee Alliance for Drug Endangered Children, and a vision that it should be placed within those coalitions because of the disciplines, and the sectors. And it just fits. It's the same thing. So, having that strategic prevention framework model and going in and talking with people about capacity. One of the things as a coalition mentor and a coalition director that I think it was the big light bulb that went off for me was when I understood that sustainability was about capacity. And you talk about that when you talk about collaboration and the cross-sector collaboration and so forth. But, in my vision is for the guide to help coalitions build that capacity in their community. Again, you can have, multiple grants, and I've done that in the past, layering of grants, and you have your organization, whether you're a nonprofit or have a physical agent, and you have all of these grants. And if you have all that money, but you haven't built the capacity, your sustainability is your capacity within your community or statewide. And I'll have to share that I feel like one of the best things that we've ever done in the state of Tennessee. Back in April, we had a Tennessee Alliance Drug Endangered Children Handle with Care statewide convening or our conference. But one of the things that we brought to that conference was we talked about statewide collaboration. I know my team, they really thought I was crazy. But I said, one of the things that I would like to do is on every table at the conference, I wanted a big ball of red yarn. And they were like, okay, so what are we going to do with this? And so we put a big bowl of red yarn on the table. And I said, so everybody at the table stand up, and they, these typically are people you're familiar with. You sit with at the table at the conference. So I said, so what I want you to do is I want you to take that ball of yarn and pass it around the table. And each person has, takes a piece of it and holds on to the big ball. So you're all connected at your table. So that's typically what local collaboration looks like. So yeah, everybody got that. And then I said, now, you got we got like 60 tables in this conference area. And I said, now I want everybody to take a step back and touch elbows with the people behind you or beside you. Well, they did that. So then we had a red sea of red yarn across the conference room. What that represented was statewide collaboration. And that is important in the work that you're doing. You can have local level collaboration. Then when you are able to provide state level collaboration, it takes it to a different level. And we have seen that over and over again across the state of Tennessee. From that Tennessee Alliance for Drug Endangered Children Handle with Care convening, we were able to bring in our state partners, whether it was like the Tennessee Department of Mental Health and Substance Abuse Services, who fund our coalitions, all 48 of them across the state of Tennessee. Or we were able to have like our Tennessee Commission on Children and Youth, Tennessee Department of Children's Services, Tennessee Sheriff's Association, just multiple agencies there that represented the state of Tennessee. But a lot of the things that was a takeaway from that was it showed what these partners had and are willing to offer to each other state agency. So we were all educated on that while we were there. But then the participants had the opportunity to see what the other state agencies had to offer and were able to bring their partners locally to the state level to see, okay, how can we build at our local capacity by utilizing what they have there?
What beautiful wisdom and a powerful experience and powerful story with that ball of red yarn, and would have loved to have been there. There is a few pictures though in the video
Right.
that folks can see as they go through the online training that goes with the guide. So I'm curious, Evangeline, what are some lessons that you've learned from some of the past Handle with Care implementations that, might inspire some folks to really get their hands on this guide?
Handle with Care, I think, can only be successful if we are doing it in a way where we're really listening to the feedback from our first responder partners. Because without them submitting a notification, the program doesn't work. And so we can have all the trauma-informed practices and everything we want, but if there's no notifications, we're not going to have that opportunity. And so I think a few of the things that we've really learned, one, how to make training as accessible as possible, and also how to make it as brief as possible. What do people actually need to know? What's the most important thing? And then also in our notification system, how do we make it so it's very streamlined, easy to use, easy to adapt? And it's also something that can be transferred to other areas. And so through that, I think we've had a lot of success. And even in our counties where maybe we haven't received much notification, sometimes some of our most impactful stories come from there. We had a situation in the past couple of years where there was a child who's at risk for truancy court, and there was someone who was advocating on their behalf who received notification. And, this child had been absent repeatedly, but they didn't have any context or awareness that there was something going on at home. They happened to get a Handle with Care notice right before they were scheduled to go to truancy court. And because of that, that individual in the pool system was able to advocate, find out a little bit more information, and realize that there had been a pattern of very serious incidents happening in this child's life. It often coincided with the accident. And so I think, sometimes for our first responders, what they don't realize, even just one notification can make a dramatic change in that children's life. And sometimes it's in the school environment in terms of the resources they're receiving. And sometimes it's through our judicial system. It really kind of depends. And so I think Handle with Care, I always tell, especially when we're working with cadets or people who are new to law enforcement, that they really can be the catalyst for ensuring children receive the wraparound service. Because oftentimes we have the resources in our community. They look different in every community in the state of Tennessee. Some of our counties have a behavioral health specialist who specifically in a school system who's able to go and provide that intervention. Some of them have one counselor for multiple schools. It's going to look different, but by having the information and then also providing the trauma-informed training, we're equipping more professionals to be able to provide support. And we know we're going to have a greater impact long-term. I think for our counselors specifically in a lot of our schools, it's been especially helpful because they're not always in the loop for whatever reason. They may be called to react or to respond. But a lot of times our school systems specifically want them on the Handle with Care notification. So they're already alert, they're already planning their day so that if they need to provide intensive care for that child, they're able to. And so I think overall, I think it's easy for some places to say, well, we're a small community. We already do that. We all talk to each other. Everyone knows everybody. But more often than not, we're not talking as much as we think we are. And we're communicating what we think is important to us and not necessarily what will impact a child because we don't know what's going to. And I think that's the beauty of Handle with Care. We don't know what's going to happen. We don't know if they're going to need support the next day or not. But because we have that heads up, we can be ready for it.
Yes. And at the heart of Handle with Care and coalition work and the Tennessee Alliance for Drug Endangered Children is collaboration. We've talked about that just a little bit so far during our conversation, but I'd like to dig a little bit deeper. And so I'm curious, Tabatha, what do you see as the role of collaboration when it comes to the success of the TADEC approach? And part two of the question, how does this guide encourage that cross-sector collaboration?
Well, one of the things that Evangeline just mentioned was the beauty of our programs working together. And I think that's so true. Well, I think the shift for us, Dave, was when we went beyond just saying that it's a drug endangered children program, and we started identifying using the prevention model that all children are drug endangered children, but to what extent and for how much risk is going to vary. When we changed that verbiage around that, I think it changed the whole structure of our work that we do in the state of Tennessee. Many times when we're presenting now where I'm presenting my portion of the Drug Endangered Children program, I will ask how many people in the audience have a drug endangered child in their life. Every once in a while, rarely, I'll have someone raise their hand and say, they have one, or they're a foster parent, they have one. But I always raise my hand and say, well, I have one. And then you can kind of see people's face. Oh, that's why she's so passionate about this. This is why she's doing this work. And then I'll tell them, but it's my granddaughter, but she's not growing up in a household where there is, alcohol or drugs or tobacco, but she's growing up in a community where all these things are prevalent and available to her. So therefore, they start saying, oh, prevention. So then I start asking them, do you have a niece, a nephew? Do you have grandchildren? And people all start raising their hands. And I'll say, now take a look around the room. You all have drug endangered children in your lives to some capacity. Well, after saying that is, using this guide, I think also shows that each and every person within a community, whether you're law enforcement, whether you're educators, medical workers, behavioral health, whoever it is, if they are part of a network, they're a community, they're a citizen, they can use this in implementing programs, again, using that prevention model that it takes everyone in the community in order to create environmental change within a community, whether it's doing the social norms, whether it's doing, creating awareness or interventions. We are truly blessed in the state of Tennessee because not only do we have prevention model, but we also have recovery and treatment as well. And because of the state of Tennessee and our infrastructure, and especially this was prevalent during that collaborative convening that we had with the state of Tennessee, we have certified peer recovery specialists that are embedded within our coalitions that assist people into getting into treatment and helping them walk their recovery path. We have regional opioid prevention specialists who are out here supported with, the distribution of naloxone. We have Tennessee Department of Health, who's also distributing naloxone out through our local health department. We have such an infrastructure in the state of Tennessee that, again, that collaboration piece and showing that it's just not one entity. It's all these entities, whether it's at the state level or, and then it just trickles down to the local level and how you can make this actually really happen within your communities. The other thing with it, I think that turned the tide for us in the state of Tennessee, again, using that prevention model was, again, you can have a great program. And I truly feel like we have a great program. But when you go out in the community, you're saying, oh, we're hosting a camp for drug endangered children, or this is our drug endangered children coordinator. Well, that's a stigma. And it took one of our drug endangered children coordinators who's in recovery to tell me this is not going to work. People, even if you are, have substance use disorder, if you have an addiction problem, you don't want your child identified and singled out. And then, it's like, oh, okay, you're exactly right. So, changing that mindset to all children are drug endangered children and bringing that back around. Again, I think it changed at the local level how we were working. We're getting more success because now it's using that prevention model and having that ongoing communication and sharing of information. But not only that, sharing those resources there in the community. Yes, we are reaching those children. If there's a handle with care notification, it could be on any child. It might not have been on a drug-related arrest or a bust or an overdose. It could have been, an environmental situation. It could have been on a healthcare situation. We have so many children being raised, by grandparents. It could have been, a grandfather or grandmother had a heart attack. Trauma, and I know Evangeline will touch on this as well, impacts children at multiple levels. And so we don't know how it's going to impact any given child. So having that dynamic there, okay, every child gets a handle with care notification sent in if a first responder or law enforcement goes on scene. Again, reducing that stigma. again, having those networks working together, education, law enforcement, the prevention aspect of it, mental health professionals, having all of those people working together and building trust within those organizations.
Trust is the bedrock, the foundation of any relationship and any collaboration. And I like how you articulated the power of simple language change and how that can help foster trust and break down stigma. Language alone is oh so powerful.
Because one of the barriers was that in the implementation of our program, and I want to be transparent here. One of the barriers was getting those kids, having programs and interventions and prevention program for them because, again, no parent wants their child being identified in that way. And you know what? Hindsight's 2020. I don't blame them. I wouldn't either. And so with that being said, changing that vocabulary around it and building the trust that, it's an intervention program, it's a prevention program. And again, having that change in that vocabulary made a big difference. I
could see the ripples from that as I got to meet all of your folks from across the state, the entire group. Amazing individuals, by the way. Now, I want to continue down this line of collaboration, and I'm curious, Evangeline, what do you see as, how Handle with Care helps strengthen collaborative efforts and really ensuring that comprehensive support for drug endangered children?
Well, I don't know what it's like in other states, but in the state of Tennessee, there's very few systems that are statewide. And there's very few systems that a law enforcement agency and a school district have access to. And so oftentimes what you find is that the information is not in real time. So we may find out the situation happened 3 days later because of this and that, but there's already been a lot that's happened in that time frame. That child may have already gotten removed from the classroom for whatever reason. They may not have access to the resources for a period of time when they really needed them. And so I think it's a quicker response. And the people who have access to it, just by the nature of them having access to it, facilitate collaboration. Because you're not having to communicate to multiple people through different means. They're all getting it at the same time. Like on the school system, you may get an SRO, a counselor, a social worker, and an admin are all getting the same communication. So they're all able to then provide their appropriate professional response. I also think that, for each kid, there's going to be the aftermath of that immediate response that's going to be needed. But for a lot of our individuals in the school system who have Handle with Care, they don't keep it in a kid's permanent file, but they remember. They remember something happened last year. And so if it comes 6 months down the road and they start noticing things, maybe it didn't show up initially, they still have that in their mind. And so whether it's, the immediate crisis response or it's long-term intervention, it's kind of a common thread that doesn't stigmatize the kid, but it says, hey, we need to be a little more curious about the situation. We need to look at the context. And I think ultimately in our communities, everyone wants to protect them. We want to advocate. But sometimes figuring out who's responsible for which part of the response is difficult as well. And I think this also streamlines this. It kind of articulates what it looks like to, on scene, there's obviously a crisis response. There's a way that those law enforcement or first responder partners are responding to that kid, getting them to a certain level of safety. But the next day at school, what supports are they equipped to provide? And I think even in just the conversations that are happening around Handle with Care, people are understanding more clearly what people's roles are. Because I think one of the biggest issues we have probably with child welfare overall is no one knows what anyone's doing. Or they misunderstand why someone's doing the things the way they are. And so we can develop a greater shared language and process. We have a better chance of the kids not falling through the cracks.
And if I'm on the other end listening, watching this video, I'm ready to know what's next. I'm on board. I want to go get this guide and start collaborating, start implementing Handle with Care. And so Tabatha, what are the next steps for professionals and coalitions, community members that are interested in getting their hands on and using the guide?
What is it for someone wanting to use this guide? Use it as a guide. Use it as a tool. We are going to be providing it on our website with our TBI Learns website. Anyone can access that. We have our PDF that we have put together. We can also have that on our website so people can go in and download that. We're going to be partnering with the National Alliance for Drug Endangered Children, for them to roll it out as much as they want. Any coalition that's interested in developing this, I'd be more than happy to share with them. Any opportunity that we can have to come out to their communities or their states to do, we can do Teams meetings, we can do Zoom, anything like that to be able to share with them, of what our successes have been, but also to be honest with you, share, what our gaps and barriers have been as well. That's all very important.
True heart for the mission, true heart for the work, and absolutely embody the better is together, and let's lift up and support each other. Absolutely. All right. Well, now, how do folks get involved with Handle with Care? How can they get this started in their communities, and what can they do to support drug endangered children in their communities?
Absolutely. I think just reach out. We are happy to, we provide support across the nation to different states that are interested in kind of learning more and kind of talking and troubleshooting through what they're trying to do, whether that's build, a full drug endangered children Handle with Care model, or they're wanting to start with a piece of it. I think, like Tabatha said, we've learned a lot. And so if we don't know it, we will find someone that does. And so just, reaching out to see, okay, like what are ways that you can increase your training or build advocacy or figure out how you can deepen the partnerships that you have in your community. Maybe you haven't thought about this before. And I think, we figured out what works for us based on the agencies, both statewide and locally in our state. But, there may be a partner agency that we have connections with too, and we're able to provide that contact information. So any ways that we can do that. And then also just kind of being able to, I think it was important for people to look at what they have locally. Sometimes we definitely see the things that we're missing in our community, but we don't look at all the strength that we have. And so what area you have there that you can build upon so that your program can be cool. And we're all happy to provide our contact information. And there is a Tennessee Dangerous Drugs task force website where there is access and pages that talk about each of our programs. But we're happy to answer emails, calls, whatever we can do, because both these programs, I think, are very personally and professionally important to me and Tabatha. And we want to see ways that we can avoid situations where kids are not receiving what they need just because we're not communicating well, or we just don't know what's available.
And I would encourage folks to know that both Tabatha and Evangeline are always just one email away and always happy to help. I want to thank you both for sharing your insights and experiences. And it's pretty clear to me that the Tennessee Alliance for Drug Endangered Children and the Handle with Care Guide is a critical step forward in creating those safer, more supportive environments for children affected by substance use. And folks, this guide brings together the knowledge, the tools, the strategies needed for a comprehensive, collaborative approach that addresses both the immediate and the long-term needs of drug endangered children. So if you'd like more details or want to stay connected, please reach out to Tabatha, Evangeline, or connect with the TBI and their Dangerous Drugs Task Force website. Together, we can make a difference for every child who deserves a chance at a safe and healthy future. Thank you all for watching, and a huge thank you to Tabatha and Evangeline for your tireless work and for joining me today for this conversation. Thank you both.
Thank you for listening to the Prevention Leaders Podcast with Dave Closson. Since prevention is better together, make sure you click the subscribe button and share this and other episodes with a friend. If you have a topic idea or guest suggestion, follow us on social media or email us at info@preventionleaders.com.